Hello and welcome. I'm Vanita Dahia, presenting on immune tolerance and resilience, particularly during the COVID-19 period. Now, it's very important for us to boost the immune system, particularly when we're exposed to infections or perhaps having autoimmune diseases where the immune system is rather compromised or where the gastrointestinal tract is impaired, or the patient may be chronically stressed. And of course, when you have COVID-19, you'll need to learn to boost the immune system. Now, we are exposed to a plethora of media associated with COVID at the moment. And what we will discover is what exactly is the virus and what does it mean to have a viral infection. And most importantly, we talk about the immune system, but perhaps get a deeper understanding of immune tolerance versus immune resilience. We'll find out about the drivers for infections and then look at specifically immune resilience. Now, when we're looking at the pathophysiology of coronavirus, it is important to understand that it is a large family of viruses. The strains cause so many diseases, they're quite severe. Severe acute respiratory syndrome. This has been a disease that presented itself in the past called SARS. MERS is Middle East respiratory syndrome. Now, the COVID-19 at the moment is in actual fact a SARS, a severe acute respiratory syndrome, but it is a specific type. It's the latest strain called COVID-19, or shortened for COVID-19. So in actual fact, you will have acute respiratory distress, and that then starts to invade the cells that line the respiratory tract. It can cause pneumonia, eventually leading to septic shock and, of course, death. So the COVID-19, in actual fact, this coronavirus, these particles are spiked proteins. They stick out from the surfaces, and these spikes hook onto the cell membranes, allowing the virus's genetic material to enter that human cell. Now, the genetic material then goes ahead and proceeds to really hijack the metabolism of the cell and say, in effect, don't you do your usual job. Your job is really now to help me multiply and make the virus. And as copies of this virus multiply, they burst out and infect neighboring cells. Now, the symptoms often start just with a sore throat, and then it crawls progressively down into the bronchial tubes, reaching the lungs. The mucous membranes in the lungs become so inflamed, and these lung sacs have to work really hard to carry the function of really supplying oxygen and to the bloodstream that circulates through the whole body. So the alveoli and the lung sacs get affected with COVID. Now, how does the virus in itself affect the immune system? Now, as a medico, as a pharmacist, we were taught that there is an innate system and an adaptive system. So I'm sure you've heard of some of these terms, but let's identify and differentiate between one and the other. When a pathogen interacts with the immune system, pathogen could be a virus, a bacteria, a fungi, a parasite, they interact with the immune system. They actually interact with the innate immune system. This is the aspect of the body at a physical or an organ or a cell level. So this is why if you touch your eyes or your mucous membranes react, you develop COVID-19. So don't touch your eyes, don't touch your mucous membranes. So this is the innate system really acting on the physical or organ or the cell level. So then over time, your neutrophils, your basophils, these are basically your white cells in the bloodstream, they go ahead and literally act like fly spray. They go and knock things out. And after, these are the sharpshooters. So after, the adaptive system then kicks in. So next time you get exposed, you don't even know that you've been exposed. And this is how vaccines have been developed, because they develop antibodies to develop a herd immune system. So the herd immunity then is developed over a period of time as the innate system transfers to supporting an adaptive system. The body then adapts to that virus. So you create a herd immunity through basically unrecognized spread of the disease via asymptomatic carriers. But there is a bigger picture. The innate and the adaptive immune system is what we were taught. We now have the capacity to go much deeper. We now have the capacity to understand a system that governs all of the systems, and that is the interferon system. It is intimately associated with the innate and adaptive system, but also the microbiota in the gut. So this is why a personalized medical model works. One size doesn't fit all. You know, our grandmothers used to use village medicines. We now know that today our immune system is actually supporting an interferon system. Now let's have a look at this modern theory. The interferon system acts between the innate and the adaptive system. So how do we actually, we'll talk a lot more about the interferon system, but what is the difference between immune tolerance and immune resistance or resilience? Immune tolerance is actually a system whereby the immune system reacts to the environment. You lose chemical tolerance, you notice that your skin starts to react, or do you start to develop allergies. Some people are so sensitive to smells, they develop mast cell activation syndrome. They lose their self-tolerance, and then eventually, over a period of time, as the immune system is further compromised, develop autoimmune diseases. Now, at no time as the current have autoimmune diseases being so rampant. People develop mold infestations, mast cell activation syndromes, Lyme disease, etc. They all affect the immune system. So the proper immune tolerance, you don't have a high degree of food sensitivities, you don't react to chemicals, and you don't have autoimmune disease if you've got proper immune tolerance. Immune tolerance will decide either whether you react or don't react to certain food proteins. But immune resilience is when your body's ability to deal with any kind of pathogen, you can now start to deal with them. When you lose immune tolerance, then you have impairment in immune resilience. So when you get exposed to different bacteria or different viruses, we all get exposed to all of these things. And the ability to prevent that pathogen from really infecting us and really causing us to have a significant ongoing immune response really depends on our immune resilience. So if we lose our immune tolerance, what does that mean? You develop a lot of food sensitivities. You react to a lot of chemicals. You don't have an autoimmune disease, but you develop that. Your immune system is already compromised in such a way that the cells are now typically involved with fighting off infections and are not efficient any longer. So immune resilience is really the capacity for extremes of trauma and stress. So when you're under a lot of emotional stress, chronic stress, physical, emotional, your resilience changes. You have different immunophenotypes from stress susceptibility. So you need to be boosted. It's all about resilience. Resilience is the process that allows your individuals to adapt. How do you adapt to adverse conditions and recover from them, from these traumas, physical traumas, emotional traumas? And so modulation or this bidirectional relationship between resilience and immunity is driven by gut microbiota. So immunity is not just your vitamin C, astragalus, your medicinal mushrooms, or your immune boosters, right? It's you got to change the inflammatory phenotype. That means to build up that resilience. So you use anti-inflammatory herbs. This to get rid of this push-pull mechanism that's likely to cause a create resilience. And don't forget the herbs to reduce anxiety and depression, because many herbs can be used to down-regulate. If you are treating your depression, you're down-regulating those very inflammatory cytokines that are involved in immune resilience. Now, the COVID-19, it's actually a virus made up of an envelope. We talked about the interferon system. So exactly what is the interferon system? We know that there's spikes on the viral surface. They link to the host receptors. They bind to their target cells via an enzyme. The enzyme is called an ACE2, angiotensin converting enzyme. We use ACE inhibitors as antihypertensives, but this particular enzyme is expressed on the cell surface of epithelial cells, of the lung, of the intestine, of the kidney, and the blood vessels. So it's very important to note that these proteins serve as an antigen to stimulate antibodies and increase your CD4, CD8 ratios. So the interferon system actually is involved in inflammation. What are these inflammatory cytokines? What we typically would call a cytokine storm. It's high levels of inflammation. So it's irritated and initiated by your antigen presenting cells. The antigen presenting cells have mainly two functions. One, it presents foreign antigen to CD4 helper cells. CD4 helper cells, basically you want to monitor your immune system if you have an infection, HIV, viral infections, etc. Basically, how you compare it is you compare the proportion of the helper CD4 T cells and to the ratio of the killer CD8 T cells. So as your inflammasomes increase, we release other inflammatory cytokines. So we release interleukin-12 to stimulate Th1 cells, and Th1 cells stimulate CD8 killer cells. So in other words, they are increasing inflammation. So those high cytokine levels will actually allow us to predict the likelihood of the course of CD4, CD8 ratio, will give us an indication of the level of or the degree at which the disease will process and progress. Now, high Th1 cells will stimulate your interferon gamma, all the other inflammatory cytokines, such as high granulocyte colony stimulating factors. You'll trigger NOD-like receptors. NOD is nucleotide oligomerization domains. These receptors are very critical in regulating the innate immune system, so they can trigger inflammasome activation. So we talk about the cytokine storm, and that's what happens in COVID-19. It stimulates a cytokine storm in the lung, leading to inflammatory conditions in the lung, ARDS and SARS, etc., and you'll get secondary infections. The immune system becomes hyperactivated to neutralize your COVID infection. So the higher the lung damage, the greater the damage to the lung, the greater the infiltration of these neutrophils and macrophages. And you get this production of these inflammatory mediators, all your interleukins. Inflammatory cytokine storm then develops into a edema, dysfunction, fluid in the lungs, dysfunction of air exchange, and multiple organ failures. So what are the symptoms when you actually see a patient with COVID? Typically, you'll see flu-like symptoms, particularly fever and a dry cough, and mainly shortness of breath. Sometimes headaches, sometimes muscle stiffness, sometimes loss of appetite, night sweats, gastrointestinal upsets and chills, etc. The incubation period is usually around anything up to 14 days. And this is why we wear masks, because transmission is via respiratory droplets and via contact. Fever, fatigue, dry coughing are typical, but in severe cases, you would likely see acute respiratory distress, metabolic acidosis, septic shock, and really fluid and mucus in the lungs. Now, it is important to identify and differentiate between what the symptoms of COVID versus a flu versus a cold. So typically in COVID-19, you would typically see shortness of breath. What's pretty common is the fever, the cough, and the sore throat. Some of the other symptoms are often associated with colds and flus as well. So it's important to be able to identify this. So who is at risk? People who have travelers, particularly, as we know, the major ships are breeding grounds for the COVID or viral infestations. People who are in contact with a confirmed case of COVID, people who have respiratory viral infections, particularly those who are immunocompromised, those who have had pneumonia, anybody who's immunocompromised, such as your cancer patients, they may be on chemotherapeutic agents. People who may have congenital immunity deficiencies, such as HIV or autoimmune diseases, and chronic medical conditions. Patients who have heart disease or diabetes, they are the ones that are quite at risk of these issues. So the drivers of infection can be associated with people who have total immune exhaustion. They have chronic infections, people who have mold or Lyme, or they lead to T cell exhaustion. So basically your exhausted T cells, they display an increased level of inflammatory receptors. And that increases the susceptibility and the severity of COVID-19. Patients who are under chronic levels of stress, they release these pro-inflammatory cytokines and your catecholamines. The catecholamines are your noradrenaline, adrenaline, dopamine. They enhance the growth of chronic secretion of these catecholamines will enhance the growth of pathogens. Patients who have poor sleep, they will increase the inflammatory markers like C-reactive protein and interleukin-6. They reduce the natural killer cell activity and CD4 levels. Aged patients, you will often find patients who are aged will have higher levels of immune compromisation, increasing the susceptibility. So there's so many theories. Who shall we blame? We know that the viral incubation period is up to 14 days. If the hygiene is not appropriate, or we know that the virus is airborne, so make sure that you are not, exposing yourself to that exposure. This is why we wear masks, we wash our hands regularly, etc. Now, there's so many theories of the origin of viral infections. Shall we blame the astrological planetary shifts? Shall we blame China or Wuhan for their animals, or shall we blame them for hacking, or shall we look at US Army that are associated or have been blamed for biohacking? The iron therapy is robbing, the red cells are being robbed of the oxygen carrying capacity, leading to free iron excess, which then is contributing towards poor immunity. Should we look at the exposure of 5G? Radio frequency communications. The media is rampant with all of these various theories. 5G has actually started, according to some media, in Wuhan, and then moved on to Italy and some of the major ships that have a high concentration of 5G. Could we correlate COVID to 5G or radiation or EMF, for example? Or should we blame the air pollution and the glyphosates in the air? whichever the way it is, we do have a viral infection, and we can test for them. Viruses are not only COVID-19. We have cyclomegalovirus, we have glandular fever, so we have Epstein-Barr virus, we have viruses that cause cold sores or herpes, we have varicella zoster. All of those can be measured. We can also measure cytokines, the level of your interferon system, your Th1 and Th2 cytokine markers can also be measured. But as far as COVID is concerned, we can actually identifying the antibodies. These are produced and secreted after being infected by the virus. So we can look at assessing your IgG and IgM antibodies. They look like the test kit looks very much like a pregnancy test kit. It's measuring your IgG and IgM antibodies to the COVID-19 virus. And this you would measure through, ideally, through different stages of the infection. And then the other test is called the PCR test, and that's generally, if you have returned from overseas in the past 14 days, then you could use the PCR testing. Obviously, you may want to look into liver function testing. You may also want to look into LDH, which is lactate dehydrogenase. This is an enzyme that converts sugar to energy. Chest imaging is also being used, so you can actually see multiple small patches or shadows, and you can see interstitial changes. In other words, the space between the cells changes in those interstitial spaces, particularly in the lung periphery. So you can see the disease and reaction time can vary based on the various types of testing, and the significance of each of these tests is expressed in this chart, and the advantage is that we actually do have the capacity to measure both your PCR as well as IgG and IgM, and that you can do through your doctor. Let's have a look at boosting immune resilience in the next webinar. Thank you so much for listening, and if you have any questions, don't hesitate to contact me. Thank you.